The so-called third wave of the pandemic is taking its toll on small-town America. Rural areas are being hit especially hard as cases of COVID-19 jump and hospitals fill up. Twin States News COVID-19 specialist Amanda Decker takes a look at why Meridian and the surrounding areas are taking the biggest hit.
It's more dangerous to be in areas like rural Mississippi and Lauderdale County and surrounding areas right now than it is to be in a big city like New York or Chicago. The Centers for Disease Control says someone living in an area like ours is 2.5 times more likely to die from COVID-19 today than someone living in one of those major metropolitan areas. Now, back in March, the nation watched as COVID-19 infections spread across big cities and hospitals were inundated. That trend shifted in early July. Infection rates jumped in places like Lauderdale and surrounding counties, and cases started leveling out in cities like New York. There are several factors at play. People in more rural areas are more likely to be in those higher risk categories, suffering from pre-existing conditions such as obesity, diabetes, and heart disease at a higher rate than people living in big cities. Locally, anyone outside the city center of Meridian has less access to health care. In fact, 136 small hospitals closed across the United States over the last decade. Access to resources such as grocery delivery services, those are also harder to come by, which means people have no option but to leave home to buy groceries and take care of other necessities. Now, the concern about rising cases in Lauderdale, Kemper, and other counties nearby is access to care and what our hospitals can handle as cases climb. Anderson Regional Medical Center has a total of 116 beds and 29 ICU beds. Right now, the hospital is caring for 18 COVID patients. 4 are in intensive care. Only 10 beds in total remain open right now at that facility. When you compare that to Jackson, where there are several medical facilities, the largest hospital has more than 500 beds. Now, health officials are hoping that this will shine a light on the importance of those mitigation standards of washing your hands, social distancing, and wearing a mask. And that's also why they say planning and logistics for the upcoming vaccine distribution is going to be key. For Twin States News, I'm COVID-19 specialist Amanda Decker.